Ever wondered just how long it takes to fully recover from ACL surgery? Stick around because I'll be sharing insights that will put your recovery concerns to rest. Hi, I'm Dr. Mark Petropoli, otherwise known as Dr. P. Got a problem with your knee? Call Dr. P. Let's talk about the essential aspects of ACL recovery post-surgery. We'll guide you through the do's and don'ts, emphasizing the importance of adhering strictly to your surgeon's and your physical therapist's instructions. We will discuss what you can do at home up to wound care. Plus, we'll tackle when to be vigilant about wound concerns. Stay tuned as we break down the entire process, empowering you with knowledge for your successful ACL recovery journey. How long is ACL recovery after surgery? The recovery time after anterior cruciate ligament surgery can vary depending on several factors. After undergoing ACL reconstruction, the typical recovery timeline spans about 9 to 12 months before a patient can resume sports participation, with the exact duration influenced by factors such as the intensity of competition and the nature of the specific physical activities involved. Individual variations in healing and rehabilitation progress and meeting certain criteria that need to be passed can impact the actual time frame for a safe and effective return to sporting activities. What to do after ACL surgery? Well, number one is adhere strictly to the post-operative instructions provided by your surgeon and your physical therapist. They will provide you with specific guidance based on your surgery and individual needs. When you're at home, elevate your leg above heart level by placing at least 1 or 2 pillows under your foot or your calf, not behind the knee. We don't want the knee bent. We want it to go as straight as possible, as soon as possible. That may be a little more uncomfortable, but that tends to be better. And this will help reduce the swelling, and repeating this process 4 to 6 times daily during the initial week post-surgery ensures your knee will remain straight and get the swelling down. After ACL surgery, it is crucial to avoid getting the dressing on your knee wet to ensure proper wound healing and to minimize the risk of infection. This is especially important during the initial stages of recovery at home. So directly after the ACL surgery, refrain from using a heating pad because that can prevent potential complications from keeping the heating pad on there too long. Initially, you want to use ice. After a week, 2 weeks, etc., you can ask your surgeon, ask your physical therapist if it's okay to use a heating pad. It's also essential to wear a prescribed knee brace if the surgeon prescribed a knee brace. It depends on what was done at the time of surgery. Most of the time, you're going to need a brace, so that's going to be carefully set to a specific limitation of movement, especially during the initial weeks. And so you want to use it when you're using your crutches for walking and avoid adjusting the brace settings independently on your own. Some protocols have physical therapy starting about a week or 2 after the ACL surgery, but immediate post-operative knee exercises can be initiated, and at Victory in Motion, we always start the post-operative rehabilitation and wound check the day after surgery. We just think that's a little bit safer. After your ACL surgery, you'll leave with a dressing, an elastic bandage, or an ACE wrap encircling your knee. It's crucial not to remove them without your provider's approval. Different surgeons say when you can take the dressing off or not, but it's usually within a day or 2. Until then, maintain the cleanliness and dryness of the dressing and the bandage. Once your dressing is removed, you can shower, ensuring your leg is wrapped in plastic to protect it from moisture until stitches or steri-strips are taken off. Afterward, you can get wet the incisions during showers, ensuring thorough drying. The bottom line we use here is that if there's any drainage on the dressing at all, don't get it wet. Once there's no drainage at all on the dressing for 24 straight hours, then the incision or incisions can be gotten wet in the shower, but no soaking in the bathtub or a hot tub or a pool, for example. Usually, on average, until about 2 weeks post-op. As always, and I can't stress this enough, and with all my things that I'm talking about in this video and all the videos, this is just an educational, informational video. This is educational, informational material, and always, always, always consult with your own surgeon and your own therapist on these issues specifically for you. I can't stress that enough. If dressing changes are necessary, loosely wrap the elastic bandage, the ACE wrap, over the new dressing, starting from the calf and continue until your provider permits its removal. In other words, you want to wrap that ACE wrap starting from down by the feet and working your way upward. That helps get the swelling up the leg and deals with that. It also will help there be less pain because there's less swelling. So speaking of pain management, you want to take your prescribed pain medications as directed to manage the pain and the inflammation. Different surgeons have different pain medications they use. Oftentimes, they'll allow you to use over-the-counter medications, which may also be recommended. After surgery, you might experience temporary numbness in your leg due to a nerve block administered by the anesthesia department during the procedure to alleviate pain. Sometimes we use those, sometimes we don't. It depends on the surgery center, the hospital we work at. Different anesthesiologists like to use those, some don't. In any event, there is a skin nerve on the quote-unquote front or the anterior aspect of the knee called the infrapatellar branch of the saphenous nerve. I know that's a big, long word, but that nerve is not infrequently affected from surgery and from incisions in the front of the knee. So there's sometimes a patch of skin on the outer, the lateral side of the knee that may remain with some decreased sensation or quote-unquote numb permanently. This almost always happens after surgery, like a total knee replacement, where a very long incision needs to be made right down the center of the knee. But it can also happen after ACL and other knee surgeries. It's also essential to consistently take prescribed pain medication, including options like ibuprofen or whatever your provider prescribed, as the nerve block's effects and the anesthesia will eventually diminish and wear off, and we don't want a sudden pain resurgence to occur. Then it's hard to catch up. So take the pain medication as instructed. Caution is advised with narcotic pain medication, as narcotics, as we know, can induce drowsiness, sleepiness, make you unsafe to drive, unsafe to walk around on your own. So in general, if you can avoid the narcotics, feel free to do so. If you know you're just going to be sitting around, you're not going to be out and about in bed at night, that might be a different story. So when should you be alarmed about the wound? If blood continues to saturate the dressing despite applying pressure, or if pain persists even after taking your prescribed pain medication, seek immediate medical attention. Redness, fevers greater than 101 degrees Fahrenheit, non-bloody or foul-smelling discharge like pus, also alarming signs such as swelling or pain in the calf, darkening or coolness of the foot or toes, chest pain or shortness of breath. These could all be signs of blood clots, either in the leg or going to your lungs, and you want to call your provider or 911 immediately. Again, any signs of infection at the incision site, including redness, swelling, or discharge, should prompt consultation with a healthcare professional, specifically your surgeon, maybe your physical therapist, or even your primary care physician if you can't get in touch with your surgeon. Should I start bending my knee after ACL surgery? Well, the timing and extent of knee bending or knee flexion after ACL surgery can vary depending on the specific surgical technique used. Also on your surgeon's recommendations and your own individual progress. Initially, your knee might be kept in a locked or extended position with limited bending to protect the surgical site and allow for healing. This is especially early on after an actual ACL repair, such as the Bear surgery, bridge enhanced ACL restoration surgery, where we grow back the ACL. Your surgeon may recommend a brace to control that range of motion. Most of the time they do. We do as well. Your surgeon may also advise you to perform ankle movements, moving your ankles up and down, lifting and lowering them about 10 times every 10 minutes, or whenever a commercial comes on the TV, move those ankles up and down 10 times. If you do that consistently for especially the first couple weeks after the surgery, that will help promote blood circulation, but it also reduces the risk of blood clots, which is huge. Whether you're in the process of recovering from an injury or surgery, our dedicated team of performance physical therapists is here to support you on your journey back to normal activities and an active lifestyle. With specialized training in sports medicine, orthopedics, metabolic fitness, strength and conditioning, our highly skilled performance physical therapists bring a wealth of expertise to address your unique rehabilitation needs. Trust us to guide you through a personalized recovery plan, ensuring a comprehensive and effective approach to your healing and well-being. So in summary, remember that the journey spans about 9 to 12 months. You have to be patient, both physically and mentally. And this is influenced by many factors, such as the nature of the physical activities involved. Strict adherence to your surgeon and physical therapist guidance is key. Encompassing practices at home, such as elevating your leg and avoiding wetting the knee dressing early on. We emphasize the significance of proper wound care, cautioning against the use of heating pads, and the necessity of wearing a prescribed knee brace if it's prescribed. Pain management, including consistent use of prescribed medications, was underscored, especially as the effects of nerve blocks and anesthesia diminish. Recognizing alarm signs such as persistent bleeding or pain and signs of infection is crucial. Lastly, we delved into the nuanced timing of knee bending, or flexion, with initial limitations and recommended ankle movements to enhance blood circulation. So, armed with this knowledge, you're now empowered to navigate your ACL recovery with confidence and diligence. Curious about what happens if ACL surgery doesn't go as planned? Join me in the next video as we explore the potential challenges and considerations in the unfortunate event of ACL surgery not meeting expectations. Don't miss out. Subscribe now for valuable information that could make all the difference in your ACL journey.